Reviewing the scientific literature to answer your questions about gender diversity, this is Classroom Psychology. And now here's your host, Dr. Cora Sargent. Hello everybody and welcome to Classroom Psychology. I'm your host Cora. Thank you so very much for joining me. It's wonderful to see you. Thanks so very much for hopping on in here and, let's learn about gender diversity together. And this week, as we do every time we come together, we listen to some interesting statements, often made in the form of confident declaration, but we take them for the questions we know that they're intended to be, and we take a look at the scientific literature to find an answer. This week, our question asker is the Canadian psychologist and author Jordan Peterson. He's also the host of a very popular YouTube series, and recently one of his episodes was Detransition, the wounds that won't heal, with the tagline on the thumbnail, "Stop the Butchers," which, for sure, maybe that's somewhat provocative, but, we're all friends here and we're used to seeing these provocative headlines and titles. Jordan Peterson has some very interesting ideas about the state of the research and about the state of research, particularly around affirmative care for transgender children and young people. Here's Jordan Peterson.
Gender dysphoria is a variant of the suffering that's associated with negative emotion, depression and anxiety. Now, depression and anxiety are the primary drivers of suicidal ideation, not gender dysphoria per se. And so they're confusing the source. Now and then there is no evidence whatsoever that transition of the medical sort actually has a salutary effect on mental health, partly because the long-term studies simply haven't been done. And the idea that we actually know from a research perspective that a child is much safer if they start transition than they are if they don't. That's simply not true. Ken Zucker's work has showed quite clearly that if you just leave the kids alone, then by the time they're 18 or 19, most of them settle into their biological identities.
Thanks very much to Jordan Peterson for such an interesting question, posed, as they often are, in the form of confident declaration. An interesting pair of questions here, and I don't think we're going to be able to go through both of them today. I thought originally when I started researching the episode that we'd be able to do both, right? That we'd be able to take a look at the evidence. The first question, is there evidence that affirmative care for children and young people, or transgender people more broadly, has a salutary effect on mental health? Jordan Peterson's use of salutary there, I genuinely had to Google it. I had no idea what he was talking about. It just means that it's a positive effect on mental health. So the question is, does affirmative care, we're going to need to define that, and then we're going to have a look at the literature to see, does it have a positive impact on mental health of people who experience it? And the second question is about detransition, and it's connected to Zucker's work. And we've talked about this briefly in the past. There are 5 studies in the 1980s that look at what we call persistence and desistance. Now, there's very controversial terms in the community and in the research, but broadly speaking, these 5 studies looked at young people who were gender non-conforming in quite broad terms and asked how many of those grow up to be transgender adults, and found that the vast majority do not, about 80% do not. Now, we've got to bear in mind that their definition of gender nonconformity was very broad in those studies, but detransition and regret is definitely something that we need to focus on at some point. So for sure, a future episode, we're going to come to the question of detransition and regret. What do people experience when they, go through transition and then decide later that it wasn't for them? That, or rather discover that it wasn't for them, right? That whatever they were experiencing wasn't alleviated by transition, or maybe there are other experiences of transition that lead people to either experience regret or to retransition to a different gender to the one that they had transitioned to. So we're going to have a look at those studies in some detail together. But today we're going to focus on the first of Jordan Peterson's questions here. He says, very declaratively, very strongly, in no uncertain terms, he says that there is no evidence that gender affirmative care, gender affirming care, has any salutary effect on mental health. And so we take it as the question that it is. Does it? Let's take a look. Now, first of all, we're going to need to define affirmative care. There are a bunch of different ways of defining the care that children and young people and trans adults receive. Now, for example, in the UK, children and young people don't really have access to much in the way of medical transition-related healthcare, particularly for people who are pre-pubescent, right? In childhood, before puberty, children really don't have access to any sort of medical intervention. There's simply social transition, this opportunity to change name and pronouns and how you express yourself in the world and invite people to relate to you in a different way, in response to a different gender to the one that you were assigned at birth. In puberty, children and young people have access to hormone blockers as a medical form of intervention to delay the onset of puberty. And then as young adults, they start to get access to hormone replacement therapy, essentially, sort of affirmative hormones, which affirm the gender that they identify with, that allow them to go down a puberty that's consistent with the identity that they experience themselves to be. And then adults have access to surgical options. Affirmative surgical options include, for trans guys, top surgery, where they sculpt a more masculine chest, and bottom surgery, known as phalloplasty. For trans women, there is breast surgery, and there's obviously bottom surgery as well, known as vaginoplasty, where a neo-vagina is constructed. So there are lots of different options. Beyond that, there's a bunch of others. There are voice surgeries. There's sort of Adam's apple reducing surgeries. There's facial masculinization or facial feminization surgeries to give people a more masculine or a more feminine appearance, respectively. There are a number of different surgical options for the trans and gender diverse communities. Now, access to these is a bit more challenging, particularly in the UK, where we have quite limited access to healthcare options for, particularly for transition-related healthcare for the transgender and gender diverse communities. But when we are talking about affirmative care, we're talking about any intervention that sort of allows a person to identify how they identify. So if a young person comes forward and says, I identify as a boy, an affirmative healthcare option, an affirmative care option would be for a school to say, okay, we hear you, we'll support you in whatever way you need. If you have a name and pronoun you would like us to use, then we'll use it. If you're trying things out, then we will help you to try things out. And that is essentially what affirmative care is. When it comes to medical transition-related services, affirmative care is simply access to these transition-related healthcare services, right? So hormone replacement therapy, hormone blockers, surgical options are all gender affirmative options, all designed to affirm the gender that a person experiences themselves to be. Remember, gender identity, that's right, that feels like home, that's what I am. When it comes to hormone replacement therapy and surgical options, the aim is to help somebody to inhabit a gender in all ways that is consistent with the one that feels like home to them. Now, this approach is sometimes pitted against other similar approaches. For children and young people in the UK, for example, we tend to use a watchful waiting approach, which is to watch and wait to see what happens for a young person and to act in ways that minimize the harm that might be done. So if a young person is experiencing profound distress as a consequence of the arrival and onset of puberty, then perhaps people give them access to hormone blockers to give them time to decide, to feel out what kind of puberty is right for them before they go down the sort of largely irreversible changes of puberty. Now, and there are other approaches, as we've kind of already touched upon in the past, that are less affirmative. Approaches that are sort of driven by an idea that to affirm somebody's experience might be to exaggerate that experience or to contribute to it in some way, and a view, therefore, that clinicians and people around children and young people have a kind of responsibility not to affirm their identity for fear that it might make them more trans. It might cement that pathway. a kind of understandable, but I guess probably to my mind, a little bit misguided approach to healthcare and to psychological support for children and young people who are transgender. Okay, so definitions aside, let's take a look at affirmative care, as broad and bold as it might be. Let's take a look at the outcomes of affirmative care as best we can find them from the literature. Now, full disclosure here, I didn't know this field of literature particularly well. And I'm no medical doctor, right? I'm a doctor of educational psychology. I am no medical doctor. And so this isn't medical advice. Like, just because affirmative care is, has these very positive outcomes potentially, doesn't mean it will have a positive outcome in your specific case, right? You need to have access to good, strong healthcare services, the right people around you, get your medical team right, and make fully informed decisions that are right for you. That's not what this podcast is about. We're just here to look at the science to see, does affirmative care lead to positive outcomes? Other full disclosure, I found there was so much work in this field. Like, when I heard Jordan Peterson say, there's no longitudinal studies in this field, I was like, okay, I appreciate that is quite possible, right? I know this field is fairly new. I know that longitudinal work is ongoing. I know there isn't that much of it. And I can appreciate that Jordan Peterson's point is probably right there. I was blown away by just how much work has been done in this field and how well we understand affirmative care and its outcomes. I was blown away. Also, I found the world's best freaking title in my search here. Blasdell, you, my friend, get the award for the best title I've come across in ages. Coming soon, ability to orgasm after gender-affirming vaginoplasty. Listen, Blasdell, bravo. You get a round of applause. Brilliant title. This field is wonderful. I really enjoyed it. A lot of this work is fairly recent, but Jordan Peterson only spoke 4 months ago about this, right? So it's not as if we're taking Jordan Peterson from 5 years ago and saying, oh, but it's no longer the case. No, this is 4 months ago. Confident declaration. And let's take a look at the literature. Our journey begins with Pigeon and colleagues in 2022. Now, Pigeon and colleagues, they did a systematic review of outcome measures reported following feminizing genital affirmation surgery for transgender women and gender diverse individuals specifically, from the International Journal of Transgender Health, a journal in which we have recently published, actually, which is kind of cool. Now, Pigeon and colleagues, really interestingly, they make this big point. 1,225 studies in this field, 93 studies got into the actual systematic review that they did. That's how, we are going to get into this together, but there are so many studies in this field that systematic reviews are not uncommon. There's a bunch of them. So, yeah, there's a load of work in this. But the first thing we need to say is that Pigeon and colleagues highlight that the field is not ideal. A lot of low quality studies in the field, a lot of small scale studies for sure, like 50 to 100 participants seems like it's very common. I was reading a bunch of this work. I think I've gone through like 30 or 40 studies reading in this field, and I just gone cross-eyed with it. But for sure, a lot of them are sort of lower quality studies. They may not have strong controls, and they have diverse outcome measurement. Really interesting. Some people are interested in like quality of life improvements. Some people are interested in sort of how people perceive their body or how their gender identity changes or stays the same. Some people are interested in suicidality and negative outcomes. Like, wow, there's so many different folks engaged in so many different aspects of outcome measurements. And it can be quite difficult, I think, to draw conclusions here. But we're going to do our best. And I think there is enough work that we can do that. In adolescence, the first thing to say is that social transition, unassisted by hormones, in those seeking intervention, does not improve mental health status necessarily, right? Really recent study by Morandini and colleagues in 2023. Their study, cool title, is Social Gender Transition Associated with Mental Health Status in Children and Adolescents with Gender Dysphoria in the Archives of Sexual Behavior. They looked at the referrals to the Gender Identity Development Service between age 4 and 17, young children and young people referred in. And they basically compared people who had been referred in who had engaged in social transition already to those who have been referred in who hadn't yet engaged in social transition. Now, the problem with this study is that these are young people, mean age of 14, and they're all seeking medical support for transition, right? Now, the challenge here is that, for sure, those who had socially transitioned and those who hadn't socially transitioned, they didn't have a significant difference in their, no significant differences in their mental health status, right? So social transition didn't seem to alleviate their emotional distress they might have been experiencing. Now, of course, that kind of does make sense. If anybody out there is trans who's gone through the process of transition, for most of us, you have to go through a process of social transition long before medical transition. And if you are in the process of puberty or post-puberty as adults, that can be very challenging because, puberty is a big deal. It does a bunch of effects that, as you can hear in my voice, are difficult to undo. And so when you've got young people who have socially transitioned versus those who haven't, you are, you're looking at a big group of people, none of whom have yet had access to gender-affirming hormones or to hormone blockers, and none of whom have any kind of medical support for their transition efforts. And so social transition at the age of 14, when you're going through puberty, is not going to be an easy journey. And I don't doubt that without the aid of kind of hormone blockers or hormones, it would be quite challenging for people to experience the kind of mental health benefits that you might anticipate from transition. So that's the first thing, is that, when we talk about affirmative care in terms of social transition, it doesn't have a negative effect, but it doesn't seem to have much of a positive effect on those seeking medical transition-related services who haven't yet received them. Now, when we're looking at affirmative hormone care, right, these are specifically cross-sex hormone replacement therapy for people who need it, right, for the transgender community. We found that, it's got some freaking benefits. There are tons of them. So here we go. Arnoldson and colleagues, 2022, they found 70 adolescents, again, these small-scale studies, but they kind of have to be, 49 trans men and 21 trans women. They found that self-perception assessed before the start of a gender-affirming hormone treatment and 6 months after gender-affirming surgeries, so that's like right at the beginning and right at the end of a transition-related experience. So you've got like the mean age at the start was 14.25, mean age at the end was 20.7. They found that domains of physical appearance and global self-worth improved significantly over the course of treatment. So they found that, while scholastic competence, social acceptance, athletic competence, and close friendships remained stable over the time of transition, they found that their sort of physical appearance, self-perception of physical appearance and global self-worth improved significantly over the course of their treatment. Allen and colleagues, 2019, looked at well-being and suicidality specifically, a longitudinal evaluation, exactly what Jordan Peterson was kind of asking. Are there longitudinal studies? I heard him say in the subtext, and for sure there is, longitudinal evaluation of the effectiveness of gender-affirming hormones for improving psychological well-being and decreasing suicidality among transgender youth specifically. They had 47 youth, again, small-scale study, not ideal, but there aren't many of us. We talked about this before. 0.2 to 0.5% maybe of the population, maybe a little bit more depending on how you define it, but there aren't many of us. So it's quite tricky to do these longitudinal studies. 47 youth, 13 to 19 years of age, mean age of 16 and a half, who received gender-affirming hormones were assessed at least 2 times before the start of treatment and at least 3 months after treatment. And they found that gender-affirming hormones increased the levels of general well-being and significantly decreased levels of suicidality in these participants. Allen's conclusion: they suggest that gender-affirming hormones are a valuable medical intervention with promising psychosocial outcomes. Orlavsky and colleagues this year, in the Journal of Adolescent Health, 75 participants, mean age of 16 and a half. They found that half of their participants were receiving gender-affirming hormonal interventions, and they found that family support was associated with fewer depressive symptoms and less non-suicidal self-injury. Friend support was associated with fewer anxiety symptoms and less suicidality, and gender-affirming hormonal interventions were associated specifically with fewer anxiety symptoms. Fascinating stuff. Okay, so let's look very quickly through a handful of really key longitudinal studies, and then we're going to get onto Turbin's work. And Turbin's work is rock and roll. Achille and colleagues in 2020 looked at 6-month intervals, participants who hadn't beforehand received any endocrine therapy, that's any hormone therapy, and then experienced hormone therapy between 2013 and 2018. 50 participants, mean age of 16. They completed 3 waves of questionnaires looking at mean depression scores and suicidal ideation, and they found that both decreased over time, while quality of life scores improved over time while engaging in hormone therapy. Allen and colleagues, 2019, 47 youth, mean age 16.5, who received gender-affirming hormones, assessed at least 2 times, once before the start of treatment and 3 months after treatment. After receiving gender-affirming hormones, these young people experienced a significant increase in their levels of general well-being and a significant decrease in the levels of suicidality. Lopez de Lara and colleagues, 2020, they found from the Children's Mercy Hospital Gender Pathway Services Clinic, 47 participants there. They had them between 14 and 18 years of age who attended the endocrinology clinic during 2018 to 19. So this is, of course, the hormone clinic. Gender-affirming hormones appear to be associated with improvements to general well-being and decreasing suicidality among the transgender youth who participated in the project. De Vries and colleagues in 2014, 55 young transgender adults, 22 trans women, 23 trans men, who received puberty suppression during adolescence. That's puberty suppression during adolescence. So those hormone blockers we discussed were assessed 3 times. Once before the start of puberty suppression at about 13 years, once when cross-sex hormones were introduced at about 16.7 years, and once at least a year after gender reassignment surgery, a mean age of 20 years. Psychosocial functioning, gender dysphoria, body image, global functioning, depression, anxiety, emotional and behavioral problems, and social and educational professional functioning, and quality of life, satisfaction with life, and happiness were all investigated. After gender reassignment in young adulthood, the gender dysphoria was alleviated and psychological functioning had steadily improved. Well-being was similar to or better than same-age young adults from the general population. So their emotional well-being had improved to normative levels as a consequence of gender-affirming treatment, including surgery in this case, but also including hormone replacement therapy. Cooper and colleagues in 2020, 148 participants, mean age of 15, just shy of 15, receiving gender-affirming hormone therapy at a multidisciplinary program in Dallas, Texas. 25 of them were on puberty suppression only. 123 had received either feminizing or masculinizing hormone therapy, and they found that young people reported large improvements in body dissatisfaction, small to moderate improvements in depressive symptoms, and small improvements in total anxiety symptoms. Amazingly. Amazing. All of these studies highlighting that hormones, either as part of or isolated, the effects of them isolated from other aspects of gender transition, are associated with a lot of quite positive effects. Now, so while hormonal affirmation is, by the looks of things, largely positive, it is not a panacea for everything. Caltiala and colleagues particularly highlight that people who experience psychiatric problems outside of gender dysphoria, their medical gender reassignment wasn't enough to improve functioning and relieve psychiatric comorbidities among adolescents with gender dysphoria. So what they say is that we've got to be a little bit cautious not to, think that everything is down to gender dysphoria. Folks with psychological challenges, mental health difficulties outside of their gender dysphoria will still need support for those, even in associate, like alongside the treatment they might be receiving for the gender dysphoria itself. Now we get onto the amazing Turban. So with all of this work going on and these longitudinal studies, a bunch of them, all relatively small scale, most of them, right? And most of them with a few kind of difficulties, some of them having a look at both hormone replacement therapy and surgery as part of that process, some of them only looking at hormone replacement therapy but looking at various different outcomes, lots of them finding it difficult to delineate between like people experiencing hormone replacement therapy in adolescence and those experiencing it as young adults, right? There's not much of a chance to delineate the different effects at different ages. Turban, oh my goodness, 2022, Turban King, Kobe, Reisner, and Kuroglian, I think I pronounced that correctly, in 2022. And this one can really only be described as an absolute corker of a study. Turban and colleagues took a look at 27,715 transgender adults captured in a non-probability sample, just as many transgender adults as they could get their hands on as part of the transgender survey. Now, they took a look at essentially asking adults when they started gender-affirming hormones, and they sort of divided their participants between those who experienced hormone replacement therapy in early adolescence between 14 and 15, late adolescence between 16 and 17, or adulthood age 18 onwards. And they took a look at the mental health outcomes of the adults in the survey. So these adults were basically remembering when they first started taking these gender-affirming hormones, and then taking a look at, what are the effects of those at different ages on the experience longitudinally as adults of mental health outcomes. Super freaking interesting. Basically, of their participants, 41% never accessed gender-affirming hormones, even though they wanted them. That's a lot, right? 41% wanted gender-affirming hormones, could not access them for one reason or another. About 0.6%, accessed gender-affirming hormones in early adolescence. These are not available to people at that age in the UK. They are available in the US, but it's still very rare that people have access to them. 362 accessed gender-affirming hormones in late adolescence, 16, 17, and 56.8% accessed gender-affirming hormones in adulthood, right? 18 plus. Now, Turban and colleagues were particularly interested in the severe end of mental distress, right? So they were looking at severe psychological distress, and they were looking at suicidal ideation. So particularly they were interested in suicidal ideation in the past year for adults in the study, and severe psychological distress in the past month. And they found that, this is what I find super interesting. Here we go. When they compared participants who accessed gender-affirming hormones during adolescence between 14 and 17 with those who accessed gender-affirming hormones during adulthood, participants who accessed gender-affirming hormones earlier had better mental health outcomes. They had lower odds of past-year suicidal ideation, past-month severe psychological distress, past-month binge drinking, and lifetime illicit drug use. So this is as strong evidence as I can find that, when we're talking about gender-affirming hormone treatment, when people say there's no evidence that gender-affirming hormones during adolescence can reduce suicidal ideation, there's no evidence that it reduces it long-term, there's no evidence that it reduces severe psychological distress long-term. This is evidence. 27,715 people in this survey, and for sure, it's retrospective. For sure, it's people looking back and saying when they first experienced, when they first accessed gender-affirming hormones, but they find pretty compelling evidence that the younger ages, if they accessed these hormones during adolescence, they had improved mental health outcomes, lower suicidal ideation, lower severe psychological distress as adults because of having had that at an earlier age. That's actually huge to me, absolutely massive. So for sure, there's evidence here to suggest that gender-affirming hormones as a form of affirmative care have quite positive outcomes longitudinally over the long term, and those outcomes are stronger for those who experience gender-affirming hormones at a slightly younger age in adolescence. Now, when it comes to surgical outcomes, things are equally interesting, I think. Brandstrom and colleagues found that people in the Swedish Total Population Register, it's a gigantic national patient register, and the Prescribed Drug Register, that's a population of nearly 10 million participants to draw from. Wild. They basically found that for transgender participants, increased time since last gender-affirming surgery was associated with reduced mental health treatment. Pretty interesting in and of itself. We have the amazing work of Javier and colleagues. In fact, this is probably the strongest work. Javier and colleagues, 2022, they basically did a systematic review, again, in the International Journal of Transgender Health, kick-ass journal, 79 included studies. And they found that transgender patients who undergo gender-affirming surgeries generally report, this is a direct quote, positive surgical satisfaction and the quality of life outcomes in the longer term. So we have very strong support here from 79 different studies that quality of life outcomes in the longer term and positive surgical satisfaction are generally the case for people who undergo gender-affirming surgeries. However, they say not all longer-term outcomes following gender-affirming surgery reported in the review were positive. A small minority of transgender men and women reported low levels of surgical satisfaction. That's from a handful of the studies reviewed. And a small minority of transgender women and men also reported regretting having surgery, again, in a handful of studies reviewed. And these are very small numbers compared to the broader picture. In many studies, they couldn't find anybody having regretted their experience, but in some, there were small numbers in who reported like regret. Often following sort of low levels of surgical satisfaction. But again, when it comes to regret, I think, and detransition, we'll cover that in a whole other episode. The other thing that this research highlighted to me, which is really interesting, Chaya and colleagues in 2022, and Trials and colleagues, or Trillies, excuse me for failing in my pronunciation, Trillies and colleagues in 2022, both highlight that Black patients are more likely to have complications from and have poorer surgical outcomes. So it's really interesting. I mean, Trillies and colleagues, they did a multivariate logistic regression and adjusted for potential pickles, basically confounders, things that might be correlated with ethnicity that are not the ethnicity itself having the impact. They basically looked at the odds of reoperation, 30-day readmission rates, and like surgical space infections. And they found that race was an independent predictor of important short-term postoperative outcomes in gender-affirming surgery. Not a surprise to anybody who's experienced systemic racism, would be my guess, that Black patients were more likely to have complications in these studies, very, very sadly. Now, finally, there's a really interesting study from Exposito Campos and colleagues this year, just published this year. And they took a look at a systematic review. So they included 22 studies from across the world looking at affirming psychological interventions. So these are interventions of various kinds, both kind of psychological, psychotherapeutic, CBT, all kinds of different modalities of intervention that were united in their affirmation of their patient's experience or their client's experience. So they were saying if a young person or an adult is saying, I am a man in the world, or I am a woman in the world, or I am non-binary in the world, then essentially what these psychotherapeutic and psychological interventions did was to affirm that experience, to say, okay, we hear you. We will help you to embody that experience in the world, help you to sort of lift the barriers that you experience, and help you to find resilience and hope and a positive identity and identity acceptance. Now, what was really interesting is that Exposito Campos and colleagues found that of these 22 included studies, overall results from them suggested improvements in psychological distress, depression, anxiety, suicidality, substance use, and substance-related risk behaviors, coping skills, stress appraisal, self-esteem, self-acceptance, social support, minority stress, resilience, hope, positive identity, and identity acceptance. Now, bearing in mind that this field is full of small studies and there's a reasonably high risk of bias in a lot of them, taking a look at 22 studies aggregating the results, we find that, yeah, it looks like affirmative care, even when applied to, outside of like the medical community, outside of medical transition, just when we're talking about psychological intervention, has positive outcomes, positive impact on all kinds of different aspects of emotional well-being and psychological functioning. It has a positive impact on all of them by the seam of things. Again, a little bit of caveat here, not the world's best kind of field of study, not the biggest samples in the world, and a reasonably high risk of bias in the methodology. That just comes with the territory of this fairly fresh field. But when we're talking about 22 included studies and authors doing their due diligence in their critique of the literature, with that in mind, this does look pretty promising, that even when we're talking about psychological effects, even when we're talking about psychological interventions, affirmative care seems to have quite a lot of positive outcomes, positive effects on the psychological functioning and well-being of both young people and adults. So I hope we've done... I hope we've got some way. I realized that today was a tour of the literature, y'all. Like, I don't want you to, whenever I present this stuff to you, I don't want you to at all think that Cora's an expert, therefore Cora knows what she's talking about, right? I don't want to be one of the people who's making confident declarations and inviting you to just take my word for it. I want to look to the literature and I want to be fully transparent about what the research is that I'm looking at and what that research seems to show and what the caveats and pitfalls are and what the promises are. I hope very much that you are still awake with me. There was a lot of research to go through, but as we look at it, as we come to our conclusion here, as we try to answer the question of our legendary question asker, Jordan Peterson, we find that for sure, there is a good deal of research around affirmative care, both when it comes to simple psychological support, when it comes to medical intervention in terms of hormone therapies, and when it comes to medical intervention in terms of surgical intervention. We find that a lot of these have got very strong studies, but a lot of them have got very good longitudinal work associated with them. And we find that on the whole, in total, affirmative care seems to be very positive for the transgender community. And who's surprised by that, honestly, right? If we take a look at everything we've taken a look at so far in the weeks that we have been together, we might come to the conclusion that, hey, gender is a broad church. Like, it is a broad experience. Lots of different people have lots of varying experiences with gender. And within that, the transgender community, non-binary community, gender fluid communities are real and valid. And if the transgender community and gender diverse communities more broadly are real and valid, then some of those folks are going to need access to psychological support, or some of these folks are going to need access to medical transition related services. And what we find is that affirmative care, listening to them when they say, I am a particular identity, it turns out that's no bad thing to do. Of course, because actually, if we take a model of gender that prioritizes gender identity, we realize that, of course, they are the gender they say they are. That's what prioritizing gender identity is. It's about listening to people, believing them when they say they identify a certain way, and trying to get barriers to their belonging out of the way, right? That's what we do. We try to together make a world where everyone can find a place to belong. Thanks so very much for joining me. You are deeply, deeply welcome here. This has been Classroom Psychology, and as always, I look forward to seeing you in the next one.